Okay, this is our next competency is our Foley insertion. I'm going to show you a male and female insertion. What it starts with is making sure that you have your supply. So we're going to assume the patient is here. What I'm going to show you, so I don't have to show you the whole thing front to back, is how the biggest difference between the male and female as we get closer is how to retract, basically, so that you can insert the urethra, or insert the catheter into the urethra. So here's how we start. We're going to open our package. We want to open this package sterilely. And that Foley package would be placed on the patient's legs, actually. For a male, the legs would be left in a straight position. For the female, they're going to be frog-legged, so that it's frog-leg position. Okay, so what I'm going to do is open this sterilely with a septic technique. I'm going to grab the gloves. These are sterile gloves, and I'm going to open glove. I'll do this away from the patient. Man, can you follow me this way? And this is the open glove technique that you just practiced and that you completed in ORPCT. Same thing. These gloves are not easy. Okay, now I'm ready to come back over here and I prepare my sterile field. This first barrier is going to be laid down in between the legs for a female or on top of the legs for a male. This fenestrated sheet is going to go around the genitals there. Okay. Now I kind of start taking this apart. So I want to organize this all. I need, this is our iodine solution. I'm going to pour iodine over the 3 cotton swabs there and set it aside. This is our KY jelly. Now, I just did that. I did it without even thinking. So this comes like this, okay? You can, why don't I show you this way? You take off the tip and squeeze the KY into your tray. Sorry about that. There's a couple different ways you can do this, but I'd like you to stick with that method. This guy, I pull the catheter out, just the tip. The biggest part about a Foley is that this catheter cannot get contaminated. You will get a UTI. The patient will get a UTI from bringing that infection in there. So what we're gonna do is make sure that it stays sterile. So this will coil up. Make sure when it coils that it's staying. I placed it in the KY there, so it'll get that lubricant on it, but it's also staying put, okay? This is for our prep. This is saline. This is 10 cc's of saline. I'm gonna put this. There's a little port right here. Can you see that, man? The 10 cc's of saline goes on the port. This is where that balloon, I'm gonna show you how this inflates. Once it's in the bladder, that's what keeps it in place, okay? Now, when you put that saline on, you are gonna test the balloon just with a couple cc's. I just wanna make sure it's working. So right now I'm at 10 cc's. I'm gonna go to about 8. Then I'm gonna bring that back. Do not leave those 2 cc's in the catheter. Okay, so now I leave everything in place. See how it's like it fights you. So make sure you have it in a position that it's not gonna get contaminated. That's the biggest thing about these. So I have it all set up. Now I'm gonna come over here. I'm gonna show you the approach for the male and then for the female. The male, I'm gonna use my left hand to grasp the penis or to spread the labia to make sure that I can get this catheter in. Once I'm touching these areas, then this hand doesn't get used. So I have one dirty hand and one clean hand. That's a good way to think of this. So I grab the penis, I make sure I have a nice grip on it, and then I take a betadine soaked sponge, clean around the urethra and I'll work my way out, and then this is garbage. Now, when you're doing this for your competency, you can use the bare cotton balls. I'm fine with that. And you bring it around and show me how you would do that and throw it in the garbage, okay? For female, I'm gonna show you that real quick. So let's just pretend this was here. Okay, so for female, I'm again approaching with my left hand, and I'm gonna use my 2 fingers to spread the labia apart so that I can see the urethra. Now with females, then the same thing. I'm gonna take that prep, I'm gonna start at the top and work my way down and drop. I'm gonna do that 3 times with the betadine soaked cotton balls, 3 times, okay? Now I'm ready for this. Now take a look. I grabbed the tip of the catheter with these fingers, and then I also grab the back so that it's not flapping all over the place and so it doesn't get contaminated, okay? I bring it over here. I wonder if I should use this with lube on it. All right, I'm gonna use it anyways, I'll clean it off. I'm gonna bring it here and insert it. With females, you always want to aim high. If that catheter, okay, this doesn't wanna go all the way, there we go. If that catheter, so with females, I'm entering and I'm gonna continue to push it in until I start to see urine, okay? I don't wanna push this in all the way to the hub, it's just until I see urine. If you're not seeing anything, there's a chance you're in the vagina. If you're in the vagina, that has to be taken out and discarded because it's contaminated. So if we're in the right spot, if we're not getting urine, sometimes you could press a little pressure on the bladder to send some urine down. Once that's done, I'm gonna hang on to the catheter so we don't lose it. Then I'm gonna inflate my 10 cc's. This is not gonna go because it's not a person. I'm gonna inflate my 10 cc's, take it off of there, and then we're good to go. For a male, when you're inserting, you're gonna insert that all the way to the hub, okay? That can go all the way to the hub. Once it's in, I should put a little pressure on the bladder, get urine, I'm seeing urine, and then I go ahead and fill the balloon with the 10 full cc's, okay? Once that's all in place, now my hands are dirty, so this is where I can clean everything up. This bag, the urine bag, will hang to the side of the bed. There's often, we don't have one in here, but there's a stat lock. It's a little sticker that can keep it attached on the patient's thigh to keep it nice and clean. So that's about it. Good luck with your Foleys.